In addition, the combination of microneedling and minoxidil has been shown to be effective in recovering what are called dead zones. So these are regions of the scalp that are either completely bald or mostly bald, for which there is essentially no stem cell population there. There are many accelerators on hair growth, but the first one that I really want to underscore is blood flow itself, which equates to the delivery of nutrients and oxygen. This is very important, and it explains a lot of the treatments for halting and reversing hair loss. For instance, one of the longest standing treatments for halting and reversing hair loss is so-called minoxidil. Minoxidil, sometimes also referred to by the brand name Rogaine, was actually a drug that was developed to treat hypertension. So this is a cardiac drug that lowers blood pressure, and it does that by causing vasodilation. It allows more blood flow, not just to the hairs on your scalp, but to hairs everywhere on your body. And indeed, most people don't realize this, but minoxidil won't just slow the loss of hair from your scalp. It is also effective at slowing the loss of hair elsewhere in your body. How does it do that? It does that by extending the anagen phase. So it basically makes that phase a bit longer. It doesn't make it much longer, which is why for most people who are losing their hair quickly or who have already lost their hair, minoxidil alone is not going to be a sufficient treatment. However, minoxidil has been shown to be effective at slowing rates of hair loss in people that are starting to experience some hair loss. So that's what minoxidil is doing. It's creating more blood flow to the hairs, which it tells you that blood flow and delivery of oxygen and other nutrients from the blood is pretty critical, if not very critical, for the support of the hair growth cycle itself. Minoxidil does have other effects. It can greatly lower blood pressure or lower blood pressure just a little bit, depending on how sensitive somebody is to that particular drug. So oftentimes physicians will start people on minoxidil dosages that are very low and then ratchet it up in order to figure out where the minimal effective dose or the kind of critical threshold is beyond which they start experiencing some pretty uncomfortable side effects, such as swelling of the ankles or headaches or dizziness. These things can happen with the use of Rogaine, aka minoxidil. Now, minoxidil has also been associated with increases in the hormone prolactin, and it tends to be antagonistic or in opposite to dopamine. Dopamine and prolactin are, as I mentioned before, antagonistic to one another. They're in sort of a push-pull. So people who take minoxidil, especially if they're very sensitive to it or they take dosages that are too high, will experience increases in prolactin that in turn can cause things like reductions in libido, reductions in overall feelings of well-being, apathy, and in some cases where the elevations in prolactin are more extreme, they can experience, for instance, increase in male breast tissue, gynecomastia, or even small bits of milk letdown, things of that sort. Okay, so minoxidil works by way of increasing blood flow to the stem cell niche below the hair. The dosage ranges of the oral minoxidil are tremendous, 0.25 milligrams all the way up to 5 milligrams once per day. The dosage range of the topical solutions tends to be a little bit more confined. Typically, it's a 5% solution, and it's recommended that people use it one time daily, maybe twice daily. It's also important, by the way, if you're going to take this route, that you actually leave that solution on the scalp for 3 to 5 minutes. This is important and should make complete sense as to why it's important. You can't just rub the stuff into your head and then rinse it off and expect it to be absorbed. It actually needs to seep down into those hair follicles and access the niche. All of the cells in our body really can respond to both chemical and mechanical cues. And when we hear needle injected in the skin, we think, that must just be damaging everything, causing all sorts of inflammation. But it turns out that low levels of inflammation caused by things like microneedling or PRP injections, or even the introduction of any kind of fluid, right? For instance, saline fluid injected into a region can cause changes in the cells in that region, causing, for instance, stem cell populations that were waning to reactivate again, causing telogen phase follicles that have melanocytes and stem cells that are dying off but not completely gone to re-enter the cell cycle. So microneedling procedures, PRP injections, things like minoxidil, they all kind of center around this same general theme of increasing blood flow, increasing oxygen, delivery of nutrients, or in the case of microneedling, increasing inflammation just enough at that local site that certain cascades of biological function that relate to proliferation of stem cells or maintenance of stem cell populations are kicked off. It's sort of like reminding the cells in that area that they need to stay alive in order to replenish whatever is lost. So sometimes a wound can actually induce some healing, although I do want to point out that the micro part of microneedling is absolutely key. And this should be obvious to you when you think about scars. I don't know about you, but I've never seen a scar with hair growing out of it. Or if there was, it was probably like one hair. But if you've ever seen a scar, if someone had their appendix out or if someone had a brain surgery, you see that scar because there is no hair growing out of it. So the micro portion of microneedling is extremely important. We are not talking about causing significant damage to a tissue in order to activate that stem cell population. We're talking about causing micro damage and micro levels of inflammation to stimulate growth. The microneedling itself is causing a physical disruption to the scalp, some degree of bleeding, inflammation, and again, all of that is part of the process by which microneedling can actually improve hair growth. And of course, there's healing that occurs of the bleeding and the damage to the follicle. This is a transient thing, but understanding the cosmetic implications in the short term as well as in the long term is certainly worth knowing. One thing that's very clear is that the combination of microneedling and minoxidil treatment together is far more effective than either of those treatments alone. In addition, the combination of microneedling and minoxidil has been shown to be effective in recovering what are called dead zones. So these are regions of the scalp that are either completely bald or mostly bald, for which there is essentially no stem cell population there, and the combination of minoxidil plus microneedling is somehow able to recover those stem cell populations and allow new hair to grow. Although the growth of that hair in those dead zone regions can take a very long time, 30 to even 50 weeks. Neither minoxidil treatment alone nor microneedling alone has been shown to be effective in recovering these so-called dead zones when those treatments are done separately. So this, I would say, is a strong reason to consider combining microneedling and minoxidil as opposed to just doing minoxidil or just microneedling. Most everyone who goes on minoxidil has to stay on minoxidil because when they cease taking minoxidil, even if they're doing other treatments, they lose the hair that they gained with minoxidil. So that is an important consideration. The decision to go on minoxidil is likely a decision to be on minoxidil for the rest of your life. My suggestion is that anyone, young, old, male, female, who's thinking about embarking on various treatments for offsetting hair loss and stimulating hair growth, consider both mechanical approaches and the approaches that attack the chemical pathways that can stimulate hair growth and can inhibit the inhibitors of hair growth. My goal in describing all that was really for you to be able to hear about various treatments and to be able to place those into bins related to their known or potential mechanisms, and then to be able to step back and evaluate which, if any, of those treatments might be right for you.